Hello, everyone. I am Dr. Tawab, co-chair of ISPRM's Communications Committee. And as we are getting very near to the ISPRM 2026 conference in Vancouver this year, so today Professor Abderrazak has joined us for an interview regarding his very interesting keynote lecture on strengthening rehabilitation in health systems through sustainable workforce development in low resource settings. So, welcome, Professor Abderrazak. How are you doing today?
Thank you. Thank you. Great.
So, I've got a few questions, very intriguing questions for you regarding your upcoming keynote lecture on Tuesday of 19th of May. And I wanted to know that why do so many low resource health systems continue to invest in infrastructure and technology, yet they fail to deliver effective rehabilitation outcomes?
Yeah, thank you for this important question. Today, we are talking about 2.6 billion people worldwide need rehabilitation. Yet, in low resource settings, up to 90% of needs remain unmet. Many countries invest in infrastructure, equipment, and technology, which is important, but rehabilitation is fundamentally people driven, not technology driven. The real gap is the workforce. In some low income countries, there are fewer than two rehabilitation professionals per million people, and the situation is even more critical. We are not only facing shortage, but a continuous loss of professionals through migration and brain drain. And those who remain are increasingly affected by professional burnouts and decline mental health. So you can build facilities, equipment, technology, but without a trained, supported, and retained workforce, there is no effective rehabilitation.
So, Professor Abdulrazak, I 100% agree with you, and I can totally relate to your concept that rehabilitation is person centered or person driven and not technology driven. And I can totally relate to the brain drain that you are talking about, which is quite prevalent in low resource settings. So, my next question is going to be a sort of a two question in one. So, bear with me. So, I just wanted to ask that what does a sustainable rehabilitation workforce actually look like in a low resource setting? And is specialist driven care alone enough?
Yes, a sustainable workforce is not only about numbers, it's about how the system functions. It should be sufficient in number, equitable distribute, multidisciplinary and integrated across all levels of care, especially primary care. And the World Rehabilitation Alliance clearly highlights the importance of investing in quality education and training. But sustainability also means addressing migration and brain drain, preventing burnout and mental health of professional rehabilitation professionals, supporting professional well-being, and importantly, specialized driven care alone is not enough at all. With 80% of rehabilitation needs in low and middle income countries, this model is not scalable. We need a blended approach, combining specialized with trained, non specialized, and community based providers.
So thank you so much for saying that specialist driven care alone is not enough. I totally agree with you. And my last question is going to be that can task shifting, community based models and digital solutions can they realistically bridge the rehabilitation workforce gap, or are we just overestimating their impact?
Yeah, this approach are essential but not sufficient on their own. Task shifting can increase access by 50% if well implemented. Community based models improve equity and access. Digital solutions can extend care and training. However, they don't replace a strong rehabilitation workforce. Their success depends on system and governance. So rather than overestimating them, we should integrate them into a broader system wide strategy. And I can say if we want rehabilitation for all, we must invest not only in infrastructure, equipment, and technology, but in people. By training them, supporting them, and ensuring that they remain in the system.
Thank you so much, Professor Abderrazak, for sharing your views with us today. And this gives us a lot to think about your upcoming keynote lecture. And I, for one, am very excited to listen to you in detail and to listen to you what kind of solutions do you provide for us. So see you soon on Tuesday, 19th of May for your keynote lecture.
See you in Vancouver. Thank you so much.
Thank you so much.